So recently, I was very fortunate that you gave me a chance to visit MD Anderson Cancer Center, and over there, I did visit and see a lot of researches happening in the lab. One such research was in the field of KRAS, which I see very common in Indian patients, and I was yet not aware. They said that their results are promising, but I want to understand the journey from the lab to mouse model to patients. How it does it translate? How much time does it take? And is there a way we can speed it up?
Yes, unfortunately, the journey is very long, and it can be as short as 4 or 5 years to as long as 20 or 30 years. I'll give you a mild example of an area that I was working with, and I think it's a model that is applicable in India. I first started collecting data on patients and their molecular abnormalities for the last 10 or 15 years. I had a young doctor, Dr. Jain, an Indian physician, who looked at FGFR author Kayanji, a specific. She published a paper on about 90 patients. And then we applied to a pharmaceutical company to conduct it in the trial. The trial was successful and eventually went to the FDA and the drug got approved. So this journey from looking at the clinical charts, the database to actually getting the drug approved was probably about 7 years. The reality is often more like 20 years. But this model, along with laboratory research, new techniques including AI, we hope that it will cut down even further to verify this.
So, of course, AI is the way to go, and we should actively incorporate AI in terms of bringing in more and more involvement in the clinical trials.